Welcome to the Demonstrating Implementation Excellence stream of SNOMED CT Expo 2024. Thank you to FAST for sponsoring this stream. My name's Nikki Ingram and I'm a senior terminologist at SNOMED International. I will be moderating today's session. All questions will be answered at the conclusion of the presentation. Online attendees, please use the Q&A button to type your question to the presenter. On-site attendees, please use the microphone provided in the room. I'm now pleased to introduce Charly Otero from Hospital Italiano de Buenos Aires, who will be presenting Terminology Services, SNOMED as the Spine of Italica, our health information system. Charly, please go ahead.
Thank you very much. So I came from Argentina. Hospital Italiano is really not a hospital, it's a network, and it's a non-profit organization that offers more than 40 medical specialties. We are a big hospital in our country. We have almost 10,000 people working with us, and we have about 2.5 million of visits per year, 45,000 surgical procedures, and almost more than 40,000 discharges every year. So the idea is to tell you how we evolutionate, how we grow our system using SNOMED CT. We have some introductions in academic, in information system, but also in technologies. And we use SNOMED to navigate all this process between the academy and between the resources that we offer to our users into our health information system. So we are more than 20 years using SNOMED in several ways, and we are trying to still using it because it resolves some of our biggest problem, that is represent what happened with our patients in the health information system. We develop our own electronic health records, so we have a problem-oriented electronic health record that had different settings depending on the patient was in each moment. And we have also a personal health record integrated with our electronic health record. As I'll tell you, the big problem that we have since the beginning of the health information system was to represent what happened with the data of our patients in the system, and we need to find some solution to represent all the domains between the healthcare into one process. And we decided to go to the idea to develop a terminology server, and we find one terminology that give us the ability to represent all the information that we have in our clinical data repository. So SNOMED answer to this question, it was part of the solution of the problem that we have. But we always thinking in the information that we get from the patient in contact with the health system. But we have then the problem that the real health of the patient has to do more with the real life than the contact with the health system. So we need also to work on how to represent all the information around the patient and their family, and find a way to put this in a system. So as you know, this information has as much or more important that we generate as a provider. So we need to represent all this in our system. So we are now talking about an ecosystem of records, and not only an electronic health record, an ecosystem that can represent the public health information, the perspective of the persons and their family, and also the perspective of the provider. That was the first things that we developed in our system. And the idea is to work between two worlds: the free text world, that is rich in details, but is probably more difficult to process, and the structured text that is probably useful for the systems, but not so accurate in the way to represent what happened with the persons. So the idea is to work first in a semi-structured way to input information into the electronic health record, using the text input and trying to work with an intelligent prompting to recognize or not if the term that the provider is using works for the health information system. So every time that the system recognizes the text, they can classify this text in a valid term, that is the option that we are looking for, but also to identify the not valid text in order to register this information and then to avoid next users inputting information that is not valid into the system. If you think in the idea in another way to show you, you have the text input like problems, procedure, diagnosis. You have the auto-codification process, the interface terminology that allow us to create clinical terms, problem list, drug list, and also the reference terminology that is SNOMED, and the output classification like ICD-9, ICD-10, LOINC as a cross-mapping solution from SNOMED to the classifications or output vocabularies. If you are thinking in the structure of the language, we have the natural language, but at the beginning of the process, the interface terminology is in the middle, the reference as SNOMED CT almost in the top, and the more aggregate information representation that is the output classifications or family of ICD classifications. So implement this kind of terminology services allow us to provide a solution easy to implement, not only in our system, but also in other information systems in the region of South America. That was intuitive for clinical users. The users don't need to identify what code they are selecting, but they are only interact with the terms that they are more familiar to recognize. Focus on the best level of clinical details, so allow us to understand that if the physician is a nurse is putting the problem or the diagnosis in the level that we need to know for example, measure the risk of this patient, and also integrate it with local extensions for specific needs, like the local extension of Uruguay or Chile also. So we recognize diagnosis, problems, procedures, medications, clinical order, and any other domain in the way that every time that the user put a text into the system identify or not this term and offer some kind of options. The first is the text that the user is inputting is valid and in an adequate level of detail. So they assign a SNOMED code and the process begin. The second alternative is the text is valid, but SNOMED recognizes that there are some other terms that could afford more level of detail, more granularity, and offer this granularity as a solution to complete the more accurate information. Then the same solution, but in this case, the level of detail is mandatory because the term is not completely defined. So if you are putting diabetes mellitus as a physician in the electronic health record, probably you need to complete saying that if diabetes is type 1 or type 2, and this is mandatory. And you have also some alternatives like recognize that there are two terms in one input or terms that are ambiguous. Ambiguous, like, for example, angina, que significance two things in Spanish, in Argentinian Spanish. And also, as I'll tell you, identify not valid terms and terms with some similarity, like a syntax similarity, and has to do with some probability type. And the last use case is the way that you are putting a new term, a complete new term, and the system has to recognize this term and begin the processes to codify this term that is going to the coders and finish the process. But to recognize semi-structured terms is not enough. We know that we have a lot of information in free text in our electronic health records. So we have now the opportunity to incorporate natural language processing techniques in our text and identify not only the clinical inputs, the clinical findings in the free text, but also, for example, identify some abbreviations and extend these abbreviations because we are working in a system that was showing commission certificate, abbreviations are not allowed, so we need to replace this abbreviation for the text. In this case, when you see a term in red, means that was originally an abbreviation that had more than one significance, and then you have to choose which of those are the correct. And when you see the term in green, means that you have only one significance for this abbreviation and was automatically extended into the text. then the system can recognize this clinical finding and also code with the SNOMED CT. And in the case that you are using the system, but in another electronic health record, you can also recognize the clinical terms into the text, and you can code this, for example, in the SNOMED and cross-map to ICD-10, ICD-11, all the terms that you need to complete. The last step is to incorporate large language models. So we have now a chat similar to ChatGPT, but that use several agents, and these agents improve when we use SNOMED code data. So we're using the codified data in that sense, and we can ask to the chat what happened with this patient. We can ask about allergy, we can ask about problems, we can ask about any other resources or domains that was in the electronic health record, and you need to find quickly because you have almost 20 years of information in our health information system. So what does SNOMED have to do with this? Every time that we put a text, we recognize because we have a thesaurus that was complete not only with the synonym that SNOMED provide, but also with all the synonym that was created into the thesaurus, and you have that interface add some synonyms that are probably not valid for the standard, but you can use this to recognize the text that was inputted. Thinking also that this is a system that was developed 20 years ago, so we are using some manual techniques, human techniques, and then we are completing this process with natural language processing and artificial intelligence. But at the beginning, we register all the different ways to say, for example, arterial hypertension, and collect all the synonym and map to the code in SNOMED CT, as you see here. But you can also work with some graphs to identify what kind of level of detail this term has. And also you have the opportunity to create some domains, create some subsets, identifying that this term was also part of a different set of values that you need to, you could use in a different perspective into the electronic health record. You have also the opportunity to map, and we have some automatical maps offered by SNOMED CT, but we create also our own cross mapping. So you have, for example, for ICD-10, different versions depending on the country declared as official. You have ICD-10 2018 for official version of Uruguay, and you have ICD-10 2014 for the official version of ICD-10 for Chile, for example, and we maintain this cross-mapping in order to provide the best answer to this kind of country. And we, for example, have some preliminary map to ICD-11 because, you know, we don't have this mapping yet into SNOMED and ICD-11. And I tell you that we provide these services not only in Hospital Italiano, but also to other institutions, and they can configure these services in the way that they use more accurate to their clinical process. So they can, for example, create their own domains, their own subsets, in order to, for example, control quality into the electronic health record, or to create some specific domains to implement clinical decision support into the health information system, or, for example, to work with the quality of data that they find in the clinical data repository using the inference rule that the SNOMED allows to do, depending on if this information is okay with the patient or you have some inconsistencies into the health information system. So we are now providing clinical terminology service to Argentina, Chile, Uruguay, El Salvador, and beginning to work with Brazil in the process to translate SNOMED to Portuguese to this country. Thank you very much for staying here.
Thank you, Charlie. Charlie will now take questions. As a reminder, if you're in the room, please use the microphone to ask your question. Does anyone have a question? I'll just check online. Anyone has a question? No. So Oh, Guillermo has one.
Oh, who recognized me. We know the history and we have been working together on this, and many of the contributions that you have made to the Spanish edition also are recognized. If you look at the SNOMED City Spanish edition at this time, how will you try to improve it to make it a better interface terminology or a better prepare, or make it better prepared for supporting searching, or you'll just go straight to AI and other techniques and whatever?
Yeah, probably this problem I answered would different if you asked me 2-3 months ago. So we are looking that artificial intelligence works okay with the process to identify. We collect some different synonyms between countries because we need these synonyms in order to recognize the terms in the different lexicons between states, between countries, but artificial intelligence resolve this quickly and good and better day by day. So we are going straight in this direction.
Okay, thank you very much.
Thank you, Charlie. There's another question in the room. Just go ahead.
Thank you for your presentation. And I have one question. How extract the entity from the raw text data using intelligent tools? I mean, the raw text data contains a very ambiguous text, such as daily text. So it is so difficult to extract the entity, medical entity from the raw data, raw text data.
So I don't know if I understand okay. So we're beginning to identify semi-structured text. So the users only put the diagnosis or the procedure. Then we move to identify clinical terms into the free text, and we recognize the entities in the free text using natural language processing. So I don't know if I understand what you want to ask. That's it.
Thank you, Charlie. With that,
Yeah.
I think we'll conclude
Okay.
this block of sessions. Thank you to our delegates on site and online for attending. And we hope to see you all next year for SNOMED CT Expo 2025 in Antwerp, Belgium. Thanks,
you.
everyone.